would like to know more about you before we actually get into the safeguard issue. What have you been engaging in before you started working with KDRDIP?
Thank you so much. My name is Wycliffe Wangwe. I've been a public servant. I worked in government for the last 25 years as a social development officer in the Ministry of Labor and Social Protection. So before I joined the project, I've worked in various counties as a social development officer focusing on community development. I started working in the ministry headquarters in Nairobi. I worked in Nyeri, I've worked in Kisii, I worked in Migori, and then before I joined this project, I was working in Samburu County as a county director for social services. Yes.
Okay, after joining KDRDIP, whatever you are doing at KDRDIP is aligned with what you were doing initially, working with communities, and now we are going to talk about the safeguards and what they are first. Let's start from there. What are safeguards? Because it's something that appears somehow complex when someone hears of safeguards, a common mwananchi. How would you define them?
Safeguards is generally about requirements and procedures, meeting requirements and procedures and processes as within as per the laws and regulations, both nationally and internationally. So it's not something very new. Safeguards is basically meeting the requirements and complying with the international laws and standards and regulations.
Looking at KDRDIP, first you work with communities.
Yes.
And for you to come up with the safeguards or what is going to guide you as you operate, did you engage the communities, or what informed the set of rules or guidance that you were going to follow?
If you look at KDRDIP and in relation to safeguards, for example, if you look at our Constitution of Kenya, it basically focuses on Kenyans and on communities that live in Kenya. It talks about the marginalized communities within the Constitution. And in relation to KDRDIP, you can look at the communities we worked. The project was working with in Garissa, Wajir, Turkana, they were marginalized communities. And then also you look at the issue of inclusion, because it's also in the Constitution about communities, about marginalized communities, about inclusion aspect, focusing on both on men and women, and also the vulnerable groups is within our Constitution. Some articles in the Constitution talks about, Kenyan Constitution talks about that. And then internationally, these are also laws that applies internationally. The issue of inclusion and sustainable development is all about safeguards. So under KDRDIP, when you talk about safeguards, we are talking about meeting the requirements and complying with the laws and regulations which stipulates what we have to do for these communities. So this is all about safeguards. Are you meeting the requirements? Are you complying as per the existing laws and regulations? How are you addressing the issues of the communities, the marginalized communities, the vulnerable communities? Yes, those kind of aspects.
You also have the social aspect that you deal with. Tell us a little more about it.
Generally, on social aspect, just like I said, is about our communities and focusing on issue of inclusion, men and women, youth, and the issue of inclusion is very key in social development, and also their own involvement and participation as an aspect of social development is that you have to involve people. You have to ensure that they participate in their own development, which is very, very key in terms of development. So we have to ensure that as you implement this project under KDRDIP, how are you involving the communities? How are they participating? Are they involved in decision making? So it should be community-driven aspects in it by bringing the communities themselves on board and taking charge of the development aspect of it. Yes.
In Kenya, there's always talk about public participation, engaging the public, and right now as KDRDIP, you had that aspect whereby before you implement something, it's the community that comes up with it, and they feel more involved.
Yes.
Having been on the ground, would you say that it has been a positive, it has brought in some positive feedback from the community? Because for you to do something there, you really have to ensure that you are reading from the same script with the communities.
It has brought a lot of aspect on it in terms of participation, because the way Dr. DIP has worked with the communities was we used the CDD model, that's community development drive model, and the project was sit with the communities themselves so that they could identify their priorities and the priority needs. So they were getting the key lead in the development aspect of what they really wanted as their own development needs. So that's what Dr. DIP was applying, that you are to engage the communities themselves so that they can come up with the community development plans, which was capturing their own needs as their priorities. They were coming up with areas to Turkana and Garissa. Yes. So participation was very key, and the communities were engaged so that they come up with their own priorities, what they really wanted. It was not anybody else deciding for them on the development needs or interventions that they required. So we listen to them, and then that's what we were able to bring and find after coming up with the plans. After that exercise.
You've talked of being in charge of the social aspect, and also we have the environmental safeguard. Maybe you can talk a little bit